Let me introduce Dr. Bruce Nicholson, a long-time friend of mine, anesthesiologist who specializes in pain medicine. He speaks nationally, respected internationally. He's a big researcher in this area. He's head of pain management at Lehigh Valley Health Network and is a member of the Medical Marijuana Advisory Board. So I want Bruce to give his thoughts on chronic pain management and the role of medical marijuana, as we read in the paper, is coming to Pennsylvania.
Thanks, Tom. I appreciate the opportunity to speak today, and I sort of titled my presentation, The Perfect Storm. Why the perfect storm? I think we can all look in the mirror and we can all say we're all partially responsible for what's going on now in society. When we look at this, these statistics are kind of alarming. 100 million Americans will have pain. A significant number of those individuals will come into my office and come into their primary care office and say, "Doctor, what are you going to do for me? How are you going to treat my pain?" And by fiat, it ends up being that pain is treated with opioids. We certainly know there's different classes of drugs. Opioids, without question, are one of the major players when we talk about treating pain, and they have been our armamentarium, our go-to resource. Unfortunately, NSAIDs in young populations work, but if you look at the statistics, it's alarming. Over 16,000 Americans die every year from complications related to NSAIDs. And so these statistics really put us sort of as myself as a pain clinician into sort of a catch-22 situation. When I see somebody that may have had a knee replacement and has great results, you look anatomically at it, you say no problem at all with it, but yet they still have persistent pain. And they come into my office and say, well, what are you going to prescribe for me? This may be a 65 or 70-year-old who's maybe had a heart attack, maybe have some cardiovascular problems. Can't put them on an NSAID. Do I really want to put them on an opioid? Well, we've already heard that opioids aren't the end-all to be-all, without question. They're a double-edged sword. They do work for a percentage of the population, but I would say, by and large, the majority of individuals, if we look at statistics as far as retrospective reviews, majority of patients in the end up with a lower quality of life when they've been on persistent opioids for a period of time. But this is actually a statistic that was published by the NIDA, National Institutes of Drug Abuse, a few years ago that I think sort of brings the point home that as I look in the mirror, I say we are the problem. When I say we are the problem, we're the ones that are prescribing the opioids. And if we look at it, physicians are responsible for 80% of all the diversion of opioids that occur out in the community. That diversion of opioids directly leads to that 40 times greater likelihood of going on to develop a substance abuse problem, particularly with heroin. There was no such thing as what was called discussions regarding what's called the endocannabinoid system, which we all have, by the way, and anyone who's exercised, anyone who's run, it's not an endorphin high that you get, it's actually an endocannabinoid high that you get. What's important to understand is the two systems, when you go out and you run any distance and you get that little high, you also have a little bit of pain related to it, right? Well, those two systems are very closely aligned, and therefore, as we've already heard, that's part of the problem. Trying to treat pain in individuals that have chronic pain or as well as acute pain, you sort of walk a very fine line from the perspective of pain and pleasure. But it's clear that this particular system in our body plays a major role in the central nervous system, peripheral nervous system, as well as the whole body and how we manage pain from an intrinsic neurophysiologic perspective. And we have certain receptors, what are called CB or cannabidiol type 1 and 2 receptors that we all, whenever we have any type of activity, whether it's pleasurable or whether it's painful, activates this system. This system modulates a significant amount of what goes on. And the more I read about it, and as I say to when I was talking to Dalen Leach and Mike Fomer, I said, I got a little nervous about the whole idea of actually going on record, because they asked me after I met with them a couple times, would you be willing to go on record to actually talk about medical marijuana to the community? I said, I don't know. And then I finally did it, and I said, it was sort of like coming out of the closet. I was one of the few clinicians who actually was willing to say, hey, we have to take a step back and understand that there may be significant benefit to this. And with that in mind, the state of Pennsylvania, I think, has actually framed and passed probably the most comprehensive of all the different medical marijuana bills that have, to this point in time, and there are 25 or 26 states now that have passed medical marijuana, has done absolutely the best job. And I have to compliment the state legislature and our governor in regards to the time and effort that they put in. But if we look at this, there are a number of different conditions, if we look and you research, that have been shown to have significant positive responses when we talk about using medical marijuana. And I'm not talking about the THC, the psychoactive component of it. We're talking about the other 300 constituents of the marijuana plant that actually play a significant role in modulating central nervous system activity and peripheral nervous system and inflammation. Believe it or not, what's called CBD, cannabinoids, are 20 times more potent than aspirin as an anti-inflammatory, with virtually no downside, with no risk factor whatsoever. With that in mind, there are a whole host of different conditions that the state actually, when they enacted the bill, allowed to be included in here. But if we look, probably the most important is chronic pain, intractable pain, whether it's neuropathic or non-neuropathic. If we look in the states that have passed medical marijuana bills, on average, according to the Journal of American Medical Association review that came out about 3 years ago, the number of deaths related to opioid overdose have dropped 23% in these states. Why is that? Well, there's some signals that suggest that individuals who actually use medical marijuana legitimately decrease their opioid consumption by over 50%. And we as clinicians are responsible for 80% of those opioids out there on the street right now. So therefore, if we can do anything to decrease that flow of opioids and improve outcomes, then we've had a positive effect. And with that, I'll close and just leave it with the fact that I think we've done a great job. I think we have a lot to learn from the standpoint of how we can manage patients with chronic pain, but I think medical marijuana put in the context of a controlled substance and an opportunity to advance medical science. And again, Pennsylvania has done a wonderful job. Tom mentioned Steve Klasko down at Jefferson. As soon as this bill was passed, within about 2 weeks, they actually formed and initiated an institute for the research related to medical marijuana as a truly established and legitimate therapy. And with that, I'll thank you and close.
Yesterday, when I got my coffee out and opened the newspaper, I saw Congressman Charlie Dent on the front page of the newspaper, and then I looked up at CNN News, and he was on CNN News, and I just said, wow, Charlie's got a lot going on this week. I don't think he's going to show up at our Opioid Epidemic conference, but I'm so proud of Charlie. I've known him for decades. He represents the 15th district almost his whole career, and I'm proud of his many accomplishments and all the things he does, but perhaps I'm most proud that we are both Nittany Lions and graduated within a year of each other. So with that, I'm going to introduce Charlie Dent and talk about the war on opioids in Washington.
Thank you, Tom, and yeah, go Lions. A few things. Yeah, I think I did one interview too many this week, actually. My staff says. Only generated 500 calls to the office yesterday. I'm pleased to tell you only 10% of them were from the district. I found out I have some folks who don't like me in the state of Texas, though, this week. But that's okay. That said, good morning, and thank you for allowing me to join you today. One of the reasons I became very interested in the opioid issue is because about 2 years ago, I was looking through the newspaper, and I look at the obituaries most days, and I saw the obituary of a young man, and I recognized his last name, and he's 20 years of age, and it disturbed me, and I saw who his mother was, who I knew, and his niece had worked for me, and And I called her into the office and I said, hey, I saw this obituary. You didn't mention it to me, but this is your relative. What? It's 20 years old. What happened? And she said, and she kind of looked over her shoulders and said, it was a heroin overdose. And so that really drove the issue home to me. And part of the reason why back in, I think it was in February or March of 2015, I held a opioid conference, heroin conference out in Berks County over in Brandywine School District near Kutztown. And we brought a lot of experts in to talk about the issue. And I learned a lot of things at that forum at the time. One, that we had some folks there, not only from the healthcare community, a lot of physicians, and Alex Rosenau was there from Lehigh Valley Hospital, and folks from some of the Reading facilities were there too. The DEA, also local law enforcement, and others with an interest in this issue. And what the DEA had told us was that the heroin that they were picking up in eastern Pennsylvania was the most lethal heroin, the purest form of heroin they had seen anywhere in the United States. So that was alarming to me. Of course, we had so many incidents, particularly in many of our rural communities at that time. Berks County was particularly hit. So that's what helped spark my interest in this. And I'm pleased to tell you that the Congress and others around the country have taken note too. And this obviously is not an issue that's affected our community, but just about every community in this country. So this morning I'd like to give you a little bit of perspective on the heroin and opioid crisis from the congressional perspective and how we're working to solve this problem. And I'll share them both as a member of the House Appropriations Committee as well as on the opioid and heroin epidemic legislation we just passed in Congress. From the funding side, as a member of the House Appropriations Subcommittee that oversees funding for our federal health agencies and specifically the VA, and I won't get into that too much this morning, but I've supported an increase in funding and resources to combat heroin and opioid abuse. Funding these different agencies and programs help states and local communities provide prevention, treatment, and recovery options. Specifically, SAMHSA, which is the Substance Abuse and Mental Health Administration, was given $581 million just to address the opioid and heroin abuse, which is a significant increase from just last year. And as part of this money, $500 million was for the first ever comprehensive state grant program for states to help address the opioid epidemic. This is in addition to the $1.8 billion for the Substance Abuse Program and Treatment Block Grant, which supports alcohol and drug abuse prevention, treatment, and recovery services. The CDC, the Centers for Disease Control, was given $90 million, an increase of $20 million from last year, targeted towards prescription drug use. I have fairly regular conversations with the director of the CDC, Dr. Tom Frieden, about a number of issues from Ebola to Zika. And usually that's what we're talking about, the latest disease and how we're going to manage it and how much money he needs to do what he's got to do. And so we have lengthy conversations, but I brought up about a year or so ago when he was in my office, we were chatting about, I brought up the opioid issue and the heroin problem. And he said, and this is before I think he issued his guidance to the medical community, but he was telling me then, boy, these things are overprescribed. These opioids, and he said these should be used, primarily. These opioids should be used primarily for acute situations, accidents and people dealing with cancer, and a lot less for these chronic conditions. And so we had a long talk about it, and he said he and his people were working on guidance, and I don't know if what the medical community thinks about his guidance, but nevertheless, he seemed to be well aware of it, and so we've had a lot of interest. Additionally, I want to mention that the appropriations bill also gave an increase to the poison control centers, since more than 90% of unintentional poisoning is caused by prescription drugs. And then on the comprehensive opioid legislation that was just enacted, that comprehensive bill on opioids and the heroin epidemic was passed this Congress and was just officially signed into law I think a little over a week ago. And I certainly was proud to support that legislation. But this law expands treatment and recovery options for those with an opioid use disorder and offers targeted addiction treatment services for those people with unique needs, including pregnant women and veterans. The bill also gives law enforcement and first responders additional access to opioid reversal drugs such as naloxone and to help save lives. So that's where we've been on this. My office can provide you a lot of information on the recently passed enacted law. Michaela Ashmar, raise your hand, Michaela. She's here from my office. We can get you any information you like on what we've done there. Another issue I just wanted to mention, it's related to the opioid situation, is our synthetic drugs. That's a related topic because obviously heroin overdoses seem to be the leading cause of death, among drug users these days. But right up there, though, and a growing problem is the issue of synthetic drugs, which we've seen a lot of over the last few years. And in 2012, I championed the legislation in the House to ban harmful chemicals used to make synthetic drugs. And now that the drug manufacturers have changed their formulas, I've introduced new legislation in this Congress to ban additional chemicals, as well as give the Department of Justice more flexibility in combating these drugs. We're trying to do is amend the Federal Analogs Act, making it easier for prosecutors to go after manufacturers, distributors, and sellers, not the users. We're not in any way going after a user of these synthetic drugs. And we've had some awful situations in this community with these synthetic drugs over the years. I guess when we first did this about 4 or 5 years ago, I think it was in 2011, I only learned about this issue when a woman from Coopersburg came up and was telling me about her son being hooked on synthetic marijuana at the time. And I didn't know it was, I'd never even heard of it. And it was legal, and this kid was doing all kinds of things that were crazy and nearly killed him. And told him that's what piqued my interest there. And so I just wanted to share with you that story about the synthetic drugs. I work very closely with Senators Rob Portman from Ohio and Grassley from Iowa and Schumer from New York. And that's when we passed the original law in 2012. And we stopped it for a while. We really did, but it has resurfaced. In the last year and a half, we've seen a lot more synthetic drugs. Actually, it's only been about a year, but these folks, largely in Europe, have already reformulated this stuff, and it's coming in, mostly through Europe. So that's another issue that I've been spending a lot of time on. I didn't anticipate to speak about medical marijuana today. One thing I will say about that, not here to argue for or against it, but one thing we have seen, though, at the VA, I oversee the funding for the VA. I'm chairman of the subcommittee that deals with all of VA funding. And one issue, of course, we're dealing with is PTSD, and we are concerned about the number of veterans who have PTSD and have serious marijuana issues. There is a concern that we're seeing there. So I just wanted to share that with you. And again, I'll conclude my remarks now because you're going to hear from my colleagues at the state level, and I think Marta too, from Senator Toomey's office. But I wanted to thank you all for allowing me to participate today, and appreciate Tom putting this whole forum together. Thank you very much.
So I'm going to introduce Dave Argall, and I'm going to assure you one of the criteria to speak on the podium today is not being a Penn State graduate, because you may think that's the case, but Dave is also a graduate of Penn State Graduate School, and he's been a member of the state Senate representing Schuylkill and Berks County, and Governor Wolf has been all over the state as a huge advocate of this opioid crisis. They just passed the budget, and perhaps Dave could address the percent of the budget and the programs that the state is doing to combat this epidemic. Dave?
Thanks, Tom. Thanks, Tom, for the invitation, and thanks for all of you. As several of the previous speakers have noticed, we all could have been doing something else on a Saturday morning, but we're here because this is important. It's damn important. I think growing up, when I was learning about heroin, we heard about New York or Philadelphia or Pittsburgh or maybe Allentown or Reading. We didn't consider it to be a Tamaqua problem, or think about the little towns that I drove down through today, South Tamaqua, Snyder's, Lake Hutto, but it's a problem. And I've learned it the hard way because and I was doing some rough math here. This section here, right here, it's about the same size as the average graduating class from Tamaqua High. Now, my wife and I graduated from Tamaqua. My dad, my grandfather, my kids just within the last 10 years. 3 of their teammates have had serious opiate issues. The one that I knew best as the Cub Scout leader 20 years ago for Lake Hotto. Now, at Lake Hotto, growing up, I would have thought we spent a lot of time with Cub Scouts learning about stay away from raccoons because you may get rabies. We probably have more raccoons at Lake Hotto than people. We didn't spend a lot of time on opiates and heroin, and I wish we would have, because one of my favorite Cub Scouts, one of my son's best friends, this kid with an amazing, he had more athletic ability in his leg than I have in my whole body. The things he could do with a soccer ball were just amazing. And he ended up in prison because of heroin. And I wish instead of maybe taking them back behind your house on the lake ice fishing, maybe we should have taken them to the Schuylkill County Prison to talk about drug abuse. The mothers that day were worried about me taking them on the lake. I can only imagine what the mothers of my Cub Scouts would have done if I would have taken them to the prison. But we really didn't understand how important this issue has become. Turns out that the boy who ended up in prison was the lucky one, because 2 of their other teammates from the soccer team and the tennis team at Tamaqua High from the class of 07, 08, 09 will have no future at all. They're gone. They've passed. One, according to his parents, when I spoke to them, a direct result of a sports injury that turned into an addiction, which turned into drug abuse. In Schuylkill County, talking to the coroner, 4 deaths in 13, 7 in 14, 9 in 15. That's not the kind of trend line that you want to see. The same thing when we checked with the coroner in Berks County. More and more and more every year. And I think perhaps what really disturbed me in talking to the coroner's office in Schuylkill County, they all died in their homes. Most of the family members of the deceased were unaware that there was even a heroin issue. And so I think what we're here today to educate ourselves. Layne, I want those statistics. And if that bill that you referenced hasn't been introduced yet, I will introduce it this month. There is no reason for that at all. As Charlie knows, we've had some problems in Harrisburg as well as in Washington with Republicans and Democrats, liberals and conservatives trying to work together on a common cause. We've especially had some budget problems in Harrisburg you may have read about once or twice or a million times in the last 2 years. But I think the one bit of good news that I can report is that Republicans and Democrats came together this year for an extra $15 million to deal with this issue. The governor wanted more, of course. It was one of the few areas where any issue got new money this year. We are in the midst of a very, very difficult budget debate that's been ongoing now for a couple of years, but we all agreed that we needed to do more in terms of treatment, in terms of prevention, in terms of education. And so I think that's why we are here today. I will be sharing what I've learned today with my annual reports and regular reports and weekly reports to the 250,000 people that I'm privileged to represent from the little town of Wummelsdorf all the way up to Lake Hotto and McAdoo. There's no doubt that this isn't, if it ever was a big city issue, it's not a big city issue anymore. It's an issue that has hit us way too close to home. You've heard here on the panel, I suspect the same is true in the audience. Many of us know people that have been directly afflicted by this terrible issue, and the status quo is simply unacceptable. We have to do better. That's why we're here today. Tom, again, thanks for the invitation.
Dave, thank you. It's always tough to be the last speaker, but we have time for Marta Gabriel to speak and have a few questions and still get you out before 11:30 on time. So I want to thank you for that. She's the regional manager to Senator Pat Toomey, who offered the Stopping Medication Abuse and Protecting Senior Act earlier this year. She's going to tell us more about Senator Toomey's efforts.
Thank you, Dr. Meade, and I hate to break the Penn State run, but Moravian Lehigh, go Greyhounds, go Mountain Hawks. Good morning. As Dr. Meade said, I'm Marta Gabriel. I'm the regional manager for Senator Toomey. I wanted to thank Dr. Meade and Coordinated Health for hosting this event and for inviting us to participate. I also wanted to just thank Donna for sharing the moving story of your daughter, Lindsay. I'm glad that she's doing well, and I'm glad that she did turn her life around. That's an amazing story. This epidemic, as we all know, as we've heard this morning, is taking lives all across our state and all across our country and breaking up families. Senator Toomey has heard it repeatedly throughout the Commonwealth. He's traveled and had town hall meetings, he's had roundtable discussions, whether it's rural, urban, or suburban communities. We're hearing this all over the state. We held a roundtable discussion here in Lehigh County a couple months ago, and Layne was integral in the discussion there and sharing his experiences, what he's seeing here in Lehigh County. And County Executive Mueller, who was here just earlier, was also very instrumental in helping us make that happen. And the kind of feedback that we got from Layne and some of the other physicians at that roundtable was really important to Senator Toomey. So thank you, Layne, for all you do and for being in the forefront and really the eyes and ears of our community as far as this problem is concerned. As chairman of the Senate Finance Subcommittee on Healthcare, Senator Toomey has traveled the state, as I said, hosting hearings, talking with healthcare professionals, law enforcement, anybody he can talk to get a better understanding of how pervasive this problem is. And based on the feedback that he has gained from throughout the state, he is advancing a three-pronged approach to addressing this epidemic and to prevent opiate addiction from occurring in the first place. And the three prongs are to reduce diversion of powerful narcotics, to reduce overprescribing, and to improve access to quality of treatment. The people who spoke here who are so integrally involved in this problem, and the gentlemen here who shared their stories, thank you for opening up to us and sharing your personal experiences with us. It makes a big difference. I think that working together, it is our hope, Senator Toomey's hope, that we can reduce the number of precious lives that are lost through opiate addiction in our region, in our state, and our nation. Thank you.
Marta, thank you. I haven't been at many of these town hall forums, but I cannot imagine a more talented, informative, dedicated, and passionate panel at any of these other forums. I want to thank Coordinated Health for supporting this, Parkland High School for hosting this, the audience for being here and contributing.